Hi, everybody, and welcome to episode number 92 of Circle of Fellows. I'm Shel Holtz. I am an IABC fellow and your moderator for today's session. I am the Senior Director of Communications at WebCore. We are a commercial builder headquartered in San Francisco and building throughout California. And I am joined by a fantastic panel today to talk about workplace wellness and the challenges of communicating wellness in the workplace. And I'm going to ask each of you to introduce yourselves. We'll go clockwise, starting with Letty.
Hi, good morning, everybody. I'm very glad to be here. I'm Leticia Narvaez. I'm in Mexico City, and I have a consulting firm. I handle mainly crisis and reputation, and I do a lot of change management and employee communications. And I have been working on this for more than 30 years.
And it's great to see you, Letty. Angela, you're up.
I'm Angela Senekas. I've also been in my own consulting firm for 22 years now. But before that, I worked in corporations as an employee communication manager and a vice president, and worked for Mercer and Hewitt and different consulting firms. We did a lot with wellness programs. But I think my primary focus today is going to be maybe some research background on what employees think about wellness programs, how they like to hear about them, more on the research side, which is what I've been doing for the last 22 years.
And great to have you with us, Angela. Stacy?
Stacy Wilson. My consulting firm is Eloquor Consulting, and while I focus primarily now on technology-related issues with employee communication, I, like Angela, have been with the big HR firms and done a lot of support work for the health and wellness and retirement practices and large international HR consultancies. And I've worked a lot with clients who have particular safety issues, which also is a key part of the wellness issue. So all of that kind of comes together. The other one that I would mention is I have a lot of experience in healthcare specifically. And that's surprisingly a case of cobbler's children, where they don't necessarily take good care of their employees' own wellness.
That's so true. And Jane, you've traveled the farthest to be with us today.
Oh, yes, I have, right to my office. Good evening, good morning, everyone from the UK. Jane Mitchell, lovely to be here. And great to be working with the four of you this morning. My experience in this field is focused primarily around something slightly different, which is it's method in our madness in the circles, which is more from the strategic aspect about what we say and what we do in relation to purpose, values, creating those work environments of belonging, and ensuring that psychological safety sits at the heart of the corporate culture. And of course, COVID has presented some very specific issues around that. So I look forward to discussing this with this esteemed group. Thank you, Shel.
Thank you, Jane. And I hope psychological safety comes up today. I've been very vested in this topic. I've read a book on it, in fact, and think that it is critical in order to makes programs around wellness, things like that, safety in particular, to Stacy's point, come to life in organizations. Before we kick the discussion off, I do want to let everyone out there watching live know that you are welcome and encouraged to share comments, experiences, observations, questions through the chat function on YouTube Live. And I know that at least one of the folks out there watching knows how to do that, because I've already seen some messages from Brian Kilgore, a longtime friend of IABC. So, Angela, you focus on research in your work. You do a lot of surveys, and I know you maintain a database of those surveys so that you can see what baselines are across all of the organizations you've worked with. And I know that a lot of organizations do survey employees on their affinity for various types of communication and programs in the workplace. How interested, based on the work that you have done, how interested are employees in wellness in the first place?
So it's interesting. If you look back historically, we didn't call it wellness or work-life balance. We used to call them employee assistance programs, EAPs, which was pretty much not preventing problems of like mental unwellness, but it was like, if there's a problem, we'll help you assess it and give you some short-term care. So when that was the focus that we had, interest was much lower than it is now for the more up-to-date ways that we're looking at it. I think about half of employees were interested in the program, and about a fourth of them felt well informed about the program. So you only had about a fourth of employees saying, gee, I wish I knew more about this wellness thing. But once we started calling it work-life balance and wellness, now the interest really jumped up. So just looking at 4 different companies, the interest levels was from 65% as a low at a defense contractor. And they were also fairly well informed there. So whenever you're well informed, you tend to have lower interest because you've heard enough and you're not interested to hear more. But then we had the high of 93 at a pharmaceutical company. Unfortunately, their people were very badly informed, and they had over half of their employees wanting to know more. So I'm guessing there that there was a real work-life balance issue there. But then when we get to COVID as a very particular kind of wellness and staying healthy, now the interest rate really jumped up, where the lowest was 76% and the highest was 94%. And we tended to do a better job of keeping people informed about how to stay well during COVID than we have just in the general area of staying healthy before COVID.
It's interesting that language seems to make a difference. Yeah. I was in a conversation where we were talking about no longer calling it mental health when we talk about it, but mental wellness. Is that a place where communicators can make a contribution by framing the discussion, by guiding the kind of language that we use when we're talking about this?
I'm going to defer that to the other people who actually communicate about it.
Well, I'm an observer of the communicator in this regard. And I'm just really, I will pick up on what you just asked, Shell, but I'm really intrigued by what Angela has just said, because I was working in this world of values and ethics. I was really buoyed up, and I don't say this with anything other than total humility and empathy for everything that everybody went through in COVID. But I was buoyed up by the opportunity that presented in terms of creating a much more empathetic environment, understanding environment, more conscious environment about people's general well-being and wellness in the workplace. Now, I'm just not, because somehow it's kind of the new normal that everybody was talking about. I thought, great, this is going to be a new normal where people really do care about people. It doesn't seem to have materialized and sustained. It seems to have become now, because of all the pressures that there are on businesses, that's where the focus has gone back to. We've gone back to stockholder and shareholder value. We've forgotten about the compassion that was there in legions during COVID. Organizations turned on a pin in order to make work-life work. And somehow we've now forgotten, and there's a demand for people to be back in the office, regardless of what might have been proven during COVID. And the language, to your point, Shell, I think communicators have potentially, others can speak to this more than me, but I feel as though the language of corporates has returned to where it was pre-COVID. And we've kind of hoping that COVID didn't really happen, but it's such an opportunity for us to shift the language and to use that understanding that was created during that time, because we learned so much about what was possible in organizations and what was important, not only to help organizations flourish and build those communities, but also for employees and for other stakeholders. So I'd really like us to be much more conscious about that. I don't know what others think
Oh,
about that.
yes. I believe the role of the communicator was key, especially during COVID and afterwards, post-COVID. But and in order to choose the language and to understand the language that we should use, and to train the leaders to use that language also, I think we must understand first what we mean by well-being, by wellness, and it's mainly the level of satisfaction of our own life, becoming a healthy and a happy human being. And wellness and well-being has different dimensions, and we should understand them in order to then develop messages and communication as professional communicators. We must understand that wellness integrates the spiritual part, that is that the individual has a purpose and enjoys the present. The physical part, that there is a balance between mind, that is the mental wellness, mind and body. The intellectual one, that is that there is a profound learning and openness to experiences. The part of relationship, how the person builds their relationship with himself or herself and others, and emotions. How does the individual is aware of their own feelings and how they handle their emotions. So if we understand this, we can then better communicate what the company is doing for wellness for their employees.
Shell, if I could add something to both of those comments, and this is a very specific reference to the U.S. I think that people generally have abdicated their responsibility for their own wellness to the employer. And that is the case in terms of actual healthcare, but also the topic we're on today. So I see a lot people kind of waiting for someone else to be interested and press the point and do something about their wellness instead of taking charge of their own wellness. And I can't speak to whether or not that's an issue outside of the US, but it's definitely a problem here.
That's really interesting, Stacey. Do you think, I'm just thinking about psychological safety, which jumps into my mind when you say that. I wonder why, and I wonder also if Letitia and Angela have experienced that, but I wonder why that might be, particularly given what we've just been talking about. Why would they abdicate, I wonder? Is it partly, and as Letitia said, this is multifaceted, this whole conversation, but I do wonder whether or not it's partly to do with a lack of psychological safety in cultures where people just don't feel. Maybe the other flip side of abdication is the fact that they don't feel they'll be listened to, or that they don't want to show any vulnerability while things are as stressed as they are in the workplace. I wonder what that's about.
Well, in my experience in working in this space, there are two things that are very influential in this situation. And one of those is the separation that we create and kind of pedestal that we put healthcare practitioners, and I mean specifically physicians, on. They are very separated from the rest of the care team. They are viewed as having such a unique and special skill set that they're sort of revered in a way that doesn't enable the patient to ask questions as comfortably. So to your point, Jane. And the other thing I think is the connection to the employer for the provision of health insurance. It kind of, we put the employer in a position of selecting the benefits, providing all the information about the benefits, and in some cases, even sort of driving employees to the benefits. So I think those are two things that I have seen to be really influential in creating a culture, if you will, where people just don't take responsibility for themselves, their own wellness, their own healthcare.
I think sort of a little bit on the flip side, sometimes the reason that they're having psychological lack of safety and this unwellness is because of things the employer is doing. So you kind of feel helpless. And I'm thinking of one client where we not only asked what their stress level was, which we had done in 1 year, this is a engagement survey, but the next year we started getting at different types of factors that create stress. And we found that in different functions or different units, they had different reasons for stress. And one of them was they had a software program that had to be finished by a certain date with no failure not being an option, or otherwise the whole banking system in the world would collapse. So that was one kind of stress, and that's not necessarily employer created. But there were others where there were managers who were waiting until Friday night to tell people they were going to have to work the weekend because something wasn't done that should have been done, or canceling vacations at the last minute. Just not planning the workload very well. And so in that case, for the increased mental wellness of those people, all we had to do was change the managers, and that reduced that whole problem. So I think it's a little bit of both, is that yes, you should take some responsibility, but what do you do when you feel like you have no control whatsoever in stopping the triggers that are creating the problem?
And I completely agree with you, Angela. I don't disagree with that at all. I think that's a huge problem, especially at the lower and middle levels of management.
Now, besides the different levels of management, and now that you're speaking about the health insurance concern, I also think that we as communicators should segment and understand that depends a lot of the different generations among the employees in order to target their interest. Not everybody is interested on the same in order to provide them wellness. For example, the baby boomers maybe would be more interested in health benefits or insurance and retirement programs, but maybe millennials would be more interested in connectivity and recreational spaces, time for personal projects, volunteer work, or Generation X would be more interested in coaching, training, professional development. So we should also understand the different interests of each group in order to focus the way we communicate and counsel the company on what kind of programs should we drive in order to create that wellness for employees.
You know, and on that, focusing on what employees need, it's not only the different age groups of what topics they might want covered or what they're most interested in. What you're talking about, how to communicate with them. I did find, looking back at the database, that some of the organizations where people felt least well informed about wellness or work-life balance or those topics is when the company tended to communicate with them primarily through their intranets, which is a very passive way of communicating. Like, you have to have an issue or a problem to start searching for help, as opposed to the companies where they either had a newsletter focused on COVID in some cases, or just a newsletter or a message from the president that came out regularly where these topics would be covered. They tended to be better informed.
And we know, don't we, from years of research, but also experience, that those organizations that communicate more generally in a face-to-face environment and equip the leaders and managers to do that have a much more highly engaged and motivated workforce. It's proven time and again. And I think that, going back to a lesson from COVID, is that people want that connection. They don't want to lose that connection. So I'm not at all surprised to hear that, but that's great evidence for communicators in organizations or as consultants to drive home the need to do something different when talking about this, and being more thoughtful and innovative about how you do communicate to have that impact. And I'm also struck, because I also think, and I've always said this about our professional communicators in IBC, is that we need to have the courage to understand, to the point you were making earlier, that those leadership skills that have elevated managers, supervisors to leaders in their role do not necessarily equate to being great communicators. They're probably brilliant at what they do in their job, and they need help. So they need support and guidance. And who better to provide it than professional communicators who know precisely how to help them do that, but be confident to do that and give them the tools and the coaching and the understanding as to the impact that their increasing communication skills will have. I'm not advocating that this gives a lot more work to communicators at all, because I'm sure they've got more than enough to do. But the fact is, I think we can box a bit clever.
I think it's important too on what exact communication role those supervisors are supposed to have, because
Right.
there were some old studies that were very badly done that said, where do you want to get all of your information? You could only choose one for all of your company information, and supervisor came up. But when you look at it topic by topic, supervisor is not the most preferred source on pretty much anything other than my compensation, how my job contributes to the strategy, and a couple of other very closely job related topics. So I think the role for the supervisors is not to be the one to communicate, we have a wellness program, or here's how it works, not that broadcasting role, but the interpretation role, saying, you know, folks, I know we're under a lot of stress right now because of this deadline we're all facing. Just want to make sure that you're aware that this is available, or something like that. So it's that interpretation, context providing, specificity providing role that they have, not the broadcaster. So I think a lot of times I've seen training done just to help people be better presenters. And that's a very minor skill for managers. It really is more listening, and it's more interpretation. So it's making sure that we see them in the right role in communicating wellness.
I'm wondering, though, that isn't the manager also in one of the best positions in the organization to see that an employee is having a wellness problem? And to point them to resources, and to let them know that the company is behind them. Is it incumbent upon communications to communicate with managers and executives, for that matter, to start to incorporate these issues into things like the one-on-one conversations they're supposed to be having with their employees on a regular basis?
Yes, definitely, Shell. I truly believe that, as Angela was saying, the leader maybe will not be the one to communicate the wellness programs, but we need to train them and to become aware that they are directly related to engagement. They must become an engagement expert, so they really understand the needs and interests of their teams, and to answer different questions in a frequent basis. Like the individual, the employee must know what is expected from them, to have ongoing conversations, not just the annual review, but really ongoing conversations, in order to be active listeners, to really understand what the employee is going through, to give recognition and praise, to give them what they need, the materials and equipment they need to do their work right, so they really think, and they really be aware that there's someone that is interested in the company, for them as a human being, not only as an employee, but that is interested in their mental wellness, in what's going through them, and so they can really do their better work.
So, Shell, I'd love to circle back on some of the comments that some of the others have made, relative to a cultural issue that I think needs to change inside organizations, around being comfortable with employees connecting with other employees outside of their work stream, if you will. So that this kind of cuts to something Jane was talking about specifically, and that is, I think we need more face-to-face people engagement to draw people into the wellness topic and the related issues. And sometimes managers in particular are not comfortable with their employees connecting with employees from other departments and other spaces if it doesn't have to do with the work that they have to accomplish. And I'll give you an example. One of my clients, it was actually in Colorado, or headquartered here anyway, they had a wellness group in the organization of employees in Colorado who liked to hike our 14er mountains. But when I've offered that as an example of how to bring employees together around a wellness activity, other clients have not been comfortable with that because they don't see the value in getting those employees connected across departments, across time zones, sometimes depending on the group. So I think there's a little cultural issue there that we need to figure out how to break down, so that managers at all levels feel comfortable letting their employees connect outside of their regular work stream.
I think one very successful thing I've seen in some organizations is using social media to do that kind of connection. And where it's been really successful is like people who say, I'm working on losing weight. I want to walk at lunchtime. Anybody want to walk with me? So they're supporting each other in these things. Or, I'm trying to quit smoking, and, anyone got any ideas on good programs for that? So that they're helping each other and supporting each other. And I think that's been a really strong use of social media for a positive outcome, not just connection theoretically, but resulting in behaviors that change.
And
Well,
maybe,
sorry, Stacey, you go.
I was just going to say, maybe, Angela, what we need to do is communicate those positive outcomes back to the managers so they understand how is that actually improving productivity, improving work outcomes as well.
And that's about building that community, isn't it? It's about having people having that sense of belonging, is using social media in the example that you gave, Angela, for people to understand that they're not on their own, that it's not just them individually that is struggling against the odds, if that's what they're feeling, but there are other people that they can connect with and that they can build an affiliation with. And that can only be to the good for the organization. I think that the thing that I think is really key to do is help the organizational leaders who are seen as a conduit for information and conversation and leadership, let's face it. That's what they're there to do, is to develop. They need to shift their habits around how they communicate themselves. But I agree. I do agree with the fact that they should actually be helped and supported to be communicators, but they shouldn't be seen as the only channel for it. But they have a massive influence on creating the culture. Let's not forget this, the figure hasn't changed, is that 65% of people in the USA would much rather leave their manager than their job. That would be the reason for them leaving. And I quoted a figure, and of course, we've got Angela on the call, so no doubt you'll correct me if I've got the figure wrong. But it's the principle is the same: is that people leave managers, they leave leaders, they don't necessarily leave their jobs. But I think that I've completely lost the thread of what I went off onto a tangent. But I think that, oh yes, I've got it, is that it's not just about an employee wellness program. And this comes back to the leadership skills and the communicator skills. I think it's fundamental to connect the dots with everything that Letitia's been talking about, that Angela's been talking about, that Stacey's been talking about. It's about connecting dots. Because if we're focusing on is a wellness program that says, look, if you're having a stressful time, plug into the wellness program, the leaders miss the point completely. It's about what they're creating in their environment to help people feel psychologically safe, to be able to say, actually, do you know what? I'm having a really bad day, or I'm having a really bad week, whatever it might be. And ensuring that people understand this is a much more strategic conversation, and an employee wellness program should be there as a support, as a last resort, not as the first resort for the leaders say, I can't deal with you, go and plug into the program.
And to that point, Jane, I'm going to go back to managers again, because if somebody says, feeling psychologically safe, I'm having a tough day, I don't feel well, I need to go home, the manager needs to support that. You can't have a manager that says, we've got a deadline, you stay here and right. Power through it, right? Right. As I mentioned at the outset, I work for a builder, we're a construction company. And during the pandemic, they recognized that they had to go further with this mentality that they'd been trying to shift to before, which is not powering through it. If you stay on the job when you're sick, you're likely to get others sick. And now here we have COVID. We definitely don't want people passing it along. So, this is, if you feel bad, speak up, go home. If you wake up feeling bad, don't come in. We have to get beyond this mentality of real gritty men who come out and work when they're sick. So I mean, telling people to speak up is one thing. Having managers who will listen is another.
I think that's really key. And it's not just the COVID and making people sick, especially in the US here with our idiotic gun culture. These people that were, these gritty men that we're trying to tell, no, you've just got to power through it. What do? They can't power through it. They go home, they get their guns, and they come back to work and shoot their bosses and their colleagues. So the stakes could not be higher in the US these days.
Right.
And definitely there must be a coherence between what is being said and what the leaders really do. I believe that the employees should really see, go to the essence of a wellness program, that they really see and perceive that there is a true concern for them. So we have to assess concern and trust in concern. Building trust in concern for stakeholders is based on a genuine caring for others, a commitment to doing what is right, and a belief that caring and commitment will generate well-being. So if the leader really acts in a genuine way, the employees will notice this immediately, and it's not only because the policy said so. Something that all of us noticed is that after COVID, people appreciated and set their priorities in a different way. Now the human touch, the interaction with human beings is better valued than before. So leaders must act accordingly to that.
Stacy, Angela mentioned that if you dump all of your wellness stuff on the intranet where people need to go looking for it when it occurs to them that they have an interest in it, that they're not likely to produce a lot of awareness around what the company's offering. Are there other ways technology can play a role in delivering useful and relevant information to people?
Absolutely. So coming back to some of the discussion we've already had around connecting people, it's all about connecting people and connecting them to tools in their real life experience. So a lot of the, well, not a lot, I won't say that, but some of the health insurance companies are doing a pretty good job of this, and they are doing things that employers can adopt around goal setting and gamifying the actual wellness activities. So whether it's getting a certain amount of steps in, or number of workouts in a week, whatever, and then providing rewards for that. And it's amazing how even small rewards can have a huge impact. It doesn't take a lot to reward, to get the behaviors. And that's what we're all about, is trying to get those well behaviors. So things like a program that Humana does, which can be adopted within the organization, where you actually wear some type of a fitness tracker, whether it's an Apple Watch or a Fitbit, and it tracks your steps, it tracks your level of activity, it tracks your sleep, and you get credit for that. If you're doing well, then you get more credit, and you get some sort of a reward in exchange for doing well with that. And that can actually drive great behavior. And then connecting within that program, people to each other, whether it's in the same office or across offices, is a way for them to communicate with each other. I did this recipe worked great for me, things like that. So it's really more about connecting the people and then introducing information in the process, rather than, like Angela said, dumping the information out there. It's not if you build it, they will come, because they won't come that way.
It's interesting, because when I looked at the different companies with their interest in information levels, there was the insurance company where people were even higher informed than they were interested. And they were pretty interested to start with, but that information level was the highest I've seen, where you actually had 12% of people who felt over-informed. And I wonder if it's because they were applying the things that they do with clients to their own employees.
That's interesting, Angela. And you mentioned that there was a pharmaceutical company where the interest was
opposite.
extremely high.
Yeah, and only 39% felt well informed. So you had over half of them saying, I need more information on work-life balance. Please help me.
And I think it's important for us not to just look at informing.
And that was an intranet, and they tend to
Yeah.
communicate about it through the internet. So they all just, makes the problem worse.
It's actually more useful for us to look at actual engagement. So we want to see, are people really engaging with the tools, and especially when you gamify some of this, it enables us to see who's really engaging, who's not engaging. Sometimes you can even do that down to the team level. You can see, teams that are super engaged and maybe they've created some competition within their own team versus those that are just not, they're just checked out. They're not interested at all. But I prefer to look at the actual engagement rather than do you feel like you're informed? Because I can be informed all day and not do anything.
Yes, and I believe
Letty, before we go on, we do have a question to share, and this is specifically for you, Stacy, from Brian. With that program from Humana, I suspect this is related to what bad things happen if you don't get all your steps in under those programs.
So in those programs, the user actually sets their step goal. So it's not necessarily the organization that's setting the step goal. As the user, I'm setting my own step goal. There's no consequence for my not reaching my step goal. I mean, obviously, in my experience, there have been times when I'm at my desk too much for a week, but I will get reminders, right? So if you can trigger the employee to get reminders, hey. It's kind of like what the Apple Watch does. If you're sitting for too long, it'll say, you need to get up. Same idea. You're not getting your steps in by Wednesday. Hey, we encourage you to get out, walk around the block, whatever. So there's no consequence for not doing it because I'm setting the goal myself, but I don't get the reward if I don't do it. And the reward might be I accrue enough points to get a new bike, or I accrue enough points to get a new Fitbit to replace my old one, stuff like that.
And by the way, where I work, there are a couple of things that you can do that are part of the wellness program that will earn you an extra day off, which we find is a tremendous incentive. Yeah. One of these is going out for the free biometric screening that you can get through the company, and the other is getting your annual physical. So those tend to be very effective, getting those extra PTO days.
Yeah, and the way is huge.
And that's thinking about things in a clever way, isn't it? Because what Stacey's just described and Brian asked the question plays right to the heart of behavioral science and nudging people to change, to shift their habits. I mean, the age-old example of, yes, I'm going on a diet on Monday. But today is Saturday, so I will have another few glasses of wine. I will have chocolate cake, but I will start on Monday. It's how do you, and it is about, that's a really great example. Once you've set yourself up, and I've heard of these, I haven't seen them, but within those communities, there's a kind of level of self-competition that takes place, because if you've said it to somebody, I'm much more likely to stick to a diet if I say to you that's what I'm going to do tomorrow or this afternoon, and you see me in a week's time or in a month's time in Toronto and you say, oh, Jane, that diet didn't go too well, did it? Well, I mean, because I've put it out there, and is that, I think that's that connection, and that knowing that you're part of a community that is joining in to do something for our own sense of well-being, whatever it might be. And then, Shell, as you say, if companies are smart enough to offer some real tangible rewards that are not just about money, that's unlikely to actually trigger too much activity beyond a certain point. But I think that when our fellow communicators are thinking about how they manage this stuff in organizations, that it's another added tool to their skill set, which is this behavioral science and nudging.
I'm just reminded, I had one client where they were building a brand new headquarters, and I've been involved with them for a number of years, and so I was involved from the beginning of this, hearing what the communicators were learning about and talking about. And the company could have built more of a high-rise building, like 10 stories. And instead they built a 3-story building that was much more horizontal, where you had to walk through the floor a lot more. And they purposely put in slightly too few elevators, because with a 3-story building, they really wanted to encourage people to walk. And the staircases are beautiful. They go right through the building in several places. And it's not like they're hidden stairways. You feel like you're going downstairs to the basement or something. And so they purposely designed the building to encourage walking, because they were very serious about wellness.
Right. Yes, and I believe the employees should see the seriousness about this. I want to share an experience I had. I used to work for a pharmaceutical company, and we were acquiring another company. So we did cultural focus groups about culture, and wellness was an issue, something that came out as something, an area of opportunity that we need to address. So we developed a wellness program in which the employees, we had like medical exams for all employees in order for them to know how they were, how was their health. And after that, after the results, many of them came out with diabetes or high pressure or something else. And we developed like a program, a health program. We changed all the kind of food that we had on the dining room. We had a gym over there. We created a gym. We had some spaces for meditation and some conferences. And so we really acted on that. And after that, we made a survey, and people was really aware that the company cared and really cared and was interested in the wellness of people, of the employees. And we really created different spaces and programs in order for them to be better. So I believe that the coherence about what it is being asked and the answers that the company does is quite important.
Shell, one of the interesting things that I would add on here that we had, I mean, it kind of broadens to an earlier point about broadening this conversation, is that if we do this stuff right and we use the technology correctly to engage people, there are a lot of business benefits that happen as a result. And the example that I would give is with one client assignment, we conducted a number of pilot tests to better understand how they could use social technology in particular inside the organization. And the test that was most popular, that was most successful, and I don't think that's me ringing, but the one that was most successful was sharing of recipes. And this sounds like a small, weird thing, but it was something that we could connect even on the health page in the benefits area for people to share recipes that they had tried and were successful and really liked. And that got more traffic in connecting people than any of the kind of strictly work-related pilots that we conducted in that project. So it was a really interesting way to see how things that are kind of on this wellness plane can help us to drive engagement with the technology and with other people in the organization. And that's going to lead to business benefits as well.
I've heard of companies that have done the recipe sharing program and then produced a recipe book with the company's imprint on it. Where I work, we do a monthly wellness newsletter, and there's always, toward the end of it, a nutrition nugget where we pick a healthy food, and that includes a recipe challenge. We offer a recipe, but we tell them you can make any recipe you like that includes this item, upload a photo of it to the Webcore Foodies channel on Teams, and we'll draw a prize from the people who submitted. They get a $50 gift card to Whole Foods for winning that every month. And that's very popular. That gets some traction.
Yes, we also did a contest of recipes, of healthy recipes within this wellness program that I was talking about. And it was very, very successful. People really, really wanted to participate, and they enjoyed and they share their recipes. And I think that creates a lot of motivation.
So, in terms of those leaders in organizations who may not see a lot of value in this, it's extraneous to the mission of the organization. We have to grind to produce shareholder value, or to meet our clients' deadlines, or to ship by the deadline. How do we convince them that this pays off for them in a bottom line sort of way? Is it a contributor to engagement, for example, for leaders who believe that engagement is an important metric?
I go beyond engagement. I take it to attrition rates.
Yeah.
And why are people leaving? Because that costs money. Engagement, it's harder to monetize that until it results in that behavior of leaving. Are they leaving because of the stress level? Are they leaving because of feeling disconnected from where they're working? And if you're doing any kind of exit interviews, or even just the reason for leaving having to be given, that could really be instructive, because then it's not just the person leaving. Now that manager who may have contributed to them leaving has to find a replacement, train the replacement. And that's a lot of their personal time that they're not going to want to be giving up.
I'd agree with that, and I'd add, and I think that it's also about attraction and retention, which is a massive, massive issue for organizations now. If they haven't got world-class talent already there and staying that they can develop, then that is a huge problem for people. And I think that's absolutely connected with what Angela has just been talking about. So it's not, it's absolutely key. I mean, it's really key. If you're not holding on to people, if you're not engaging, making them feel motivated with a sense of transparency and openness, where people feel as though they're contributing and are motivated to contribute, then they'll simply leave. So if that's not a whole selection of business reasons that we've given, then I don't know what are, frankly.
And the other one might be just connecting it to benefits information, that if people who are experiencing certain negative health related issues, it increases the number of days they lose from work, and it's costing the company more money. So it just depends on who you're trying to convince, if it's someone up in headquarters or if it's somebody who's like at the manager level.
And Angela, I would add one more to that, and that is cost of claims, which is that's just cash out the door for the organization, is paying on claims. So, we want to look at that trend line on claims when you launch a wellness program, because that's one of the bottom line things that you're really after, is trying to bring that cost of claims down.
And Stacy, looking at those costs of claims, actually looking at the claims in general, can identify what kinds of health issues exist in the organization. Do you find that organizations are paying attention to that and tailoring their wellness programs to what the data says their employees are going through?
I think the smart ones are. I think the smart organizations are definitely doing that. And this is not a new thing. This has been around for decades now. But there's definitely an opportunity to understand your particular. So in healthcare, we call it population management. So what we're trying to do is identify those kind of bigger, longer term, and very costly healthcare issues that we need to manage better. And so if you can identify, even just a couple of those and start to work toward really managing that, you'll bring your claim costs down. Definitely.
And answering some what you mentioned also, Shell, about how to persuade leaders. Another point that I think we should stress is that people like to be listened to. If the leader asks and takes into account the opinions and suggestions of their team, we should focus also in the benefit that diversity brings. Diversity of opinion, diversity of experiences, and that will make the leader more successful, because they can take better decisions when they really listen to the diverse and different opinions of the team, and at the same time, the employees will like that they were listened to. So I think that's another point that we should emphasize to leaders.
I want to focus on mental wellness for a little bit. I think that's a dicier issue for a lot of people in organizations, where they might be willing to address some sort of a physical wellness, even if it's just getting healthier and exercising more, getting your steps in. In fact, my watch buzzed in the middle of our conversation saying time to get walking. But people are more reticent, I think, to be forthright and forthcoming about mental challenges that they might be facing. We hear a lot about the fact that there's a mental health crisis in the US. The Surgeon General has recently proclaimed loneliness to be a national health emergency. What role does the organization have as part of its wellness effort to confront these types of issues?
That's such a tricky question, isn't it? And I was looking, not because I'm maudlin in any way, but I thought this question might come up. And I was looking at suicide rates in the UK here earlier on today. And in this country, in England, men, by and large, are 3 times more likely to commit suicide than women. And within that number, men between the ages of 50 and 54 and 30 and 34 are the highest, there is the highest prevalence of suicide. So when I was reading it and thinking about it last week, I was wondering whether or not any correlation has been done between those groups of people and what happens and workforce statistics and people within workforces, because clearly there's a lot of both of those groups in workforces. And I'd be really interested to see if there is something that is related to work pressure that helps to just uncover what's going on. It's been described as an epidemic here, these suicide rates for men within these groups. So I don't think that it can be entirely separated from what's going on in a work environment. And I think that clearly I haven't got all the facts around that, but I do think that it's worthy of more investigation.
Yeah, suicide in the construction industry, we have one of the highest suicide rates.
Right.
And it's something that in my organization, our CEO is deeply committed to addressing. But one of the challenges is, Angela, you mentioned that earlier we used to talk about wellness as EAPs. It's something you had a contract with an employee assistance program, and you just directed people there, whether it was a financial issue or an emotional issue or what have you. But nationally, the percentage of employees who take advantage of their company's EAP is around 5%.
Right.
Which, kind of makes me wonder, is that the right approach, or are we not communicating the value of an EAP enough? Do we need more testimonials from employees who have benefited from it? I mean, how do we address this? It seems like whether the EAP itself is to blame or not, it doesn't seem to be a solution that's working.
Well, I'm reminded of when I was back in the workforce, the corporate workforce. I'm still in the workforce. I had an employee whose performance was really just dropping off. He was forgetting things. He was staring off into space. He just wasn't himself. And after about a week or so, I had lunch with him and said, what's going on, John? That you just don't seem like yourself, from a very caring perspective. And I found out that he was going through a divorce. His wife had cheated on him and he was really distressed. And I was just thinking, I'm so glad he was reporting to me, because the new boss that I had came from a labor negotiation, union busting background. And he would have said, get with a stick or get out of here. What difference those two approaches would make with that employee. He felt cared about when I talked with him about it. And maybe that's part of that training we need to do with managers, is recognizing when an employee's behavior seems to be changing, and in a very caring way, talk with them about it. Now, you don't want to get too much into people's personal lives, but when it affects their work, that's where you start that conversation is, I've noticed this changing about you. Is there something going on that I can help you with? And just to make it comfortable for them to talk about it. And then at that point, that manager could recommend some kind of person to talk to. from a better place of just saying, hey, you got a problem, go there. I don't want to hear about it.
Yeah, it's
Yes.
interesting. I was just reading this morning an article from a business publication that suggested that one way to build trust between a manager and employees is to spend 15 to 20 minutes one-on-one with employees every week.
Yeah.
Most companies require a one-on-one between managers and employees monthly, every 6 weeks. But those are, hour, 90-minute sit downs, review performance and everything, as opposed to 15 minutes. How are things in your life? Anything I can help with? What's going on? Right? It's just showing that you care beyond making the quota for the day.
Yes, and show a genuine caring, as I was mentioning. I believe we all are integral individuals, human beings. So if loneliness and depression are growing, so I believe that this one way or another will affect also the workplace and the individual in the workplace. So that's why it's so important that the leader, the manager, is communicating and actively listening to their teams in order to understand what's going on, and then to do something to help them, because it's an integral way of acting.
And Shell, to add to what you said, the virtual work or remote work makes that contact even more important. The research around this actually shows that you need to about almost double the communication that you're having with those virtual or remote employees to be successful. So we can't kind of lean on the old communication approaches. And I'm talking at the manager level. I don't mean the professional communicators, but we've got to really increase those touch points. So, even once a week might not be enough. And like you said, it doesn't have to be long, but you need that opportunity for that touch point more in a virtual or remote situation.
Yeah. And maybe there's a role for the communicator to help those managers and leaders feel more comfortable with doing that, because it's something that comes naturally to communicators, having trained, or even if it does come naturally, but may not necessarily. So I do think it's a more strategic and kind of coaching role that communicators can play in organizations that shouldn't be underestimated.
And does that start with the executive leadership team doing those check-ins with their direct reports? Because the data says that managers are experiencing burnout at higher levels than the rank and file right now.
Yes.
Right.
Mm-hmm.
Unfortunately, I don't think we can expect it to start at the top. I think in some organizations, it's going to have to start kind of in the middle, because we don't always have leaders at the most senior levels who are great at doing this either.
By the way, I want to let you all know that you're appreciated. Mario Lopez is watching and says, excellent points of view and contributions. It should be a highly relevant issue for the CEOs of all companies.
Yeah.
Thank you, Mario. And we just have a couple of minutes left. So I want to give you the opportunity to share any final observations that you may have. Or I can just let everybody know what's coming next month.
I think the one thing I would just ask people to take away from this is what's just been covered, apart from everything else, of course, is that these are human beings we're talking about. And of course, with the advance of AI, which is all over everywhere, global news outlets all the time now, we're not replacing people with robots. We still have to ensure that people do feel motivated and engaged. So for me, it's about joining dots and ensuring, as Letitia said, that people understand that this is about human beings and their connections.
I was playing with a new AI tool. This one was introduced by Reid Hoffman, who's one of the founders of LinkedIn. It's called Pi. You can find it at heypi.com, pi.com. And it's wellness oriented. And it seems to be pretty good from the short experimentation that I did with it. I shared it with our wellness team as something they may want to just let people know is out there and available free right now. Thank you all for a great conversation. I do want to let everyone know that next month's Circle of Fellows is the annual episode in which we have a conversation with our new fellows. I will be joined by Neil Griffiths, who's the chair of this year's Fellows Committee, and new fellows Russell Grossman and Ginger Homan. And we'll talk about their career paths. And these tend to be fairly freewheeling conversations that cover a lot of ground as opposed to a narrow focus on a topic like wellness or crisis or something like that. So this will be on Thursday, June 22nd. It's the fourth Thursday of the month instead of the third to accommodate the schedules of our new fellows. And it'll be at noon Eastern time. Hope to see you all there. Again, great conversation. Thank you, everybody.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye. Stay well.
You too. Bye-bye.